Hello everyone. Thank you very much for joining us for this Network Mind Out webinar. Today we're going to be talking to Penelope Strauss, who's going to be presenting on barriers to healthcare experienced by trans young people. My name is Sally Morris. I'm the National Mind Out Project Coordinator with the National LGBTI Health Alliance. And before we kick off with today's webinar, we'd just like to acknowledge the traditional owners on the land on which we're gathering today. And considering that we have people from all over Australia, we are representing many countries here today. So thank you for joining us. So today, Penelope, who's from the University of Western Australia and has an interest in trans health, she's actually going to be presenting on the Trans Pathway Project, which actually was a really large Australian-based study on the mental health and wellbeing of trans young people here in Australia. And of particular interest of this report was talking about the things that get in the way of trans young people accessing healthcare. We also are going to be giving you a link to the report so you can check that out as well. But before we hand over to Penelope, just a couple of logistics. So we have an attendee chat box that is on the left-hand side of your screen. And if you have any sort of issues or concerns with sound or audio or anything on those lines, you can just, or if you want to introduce yourself, you can chat there. If you want to, Penelope is going to be taking questions at the end of her presentation. And if you want to submit a question, there is a little box up the top of the screen. So I'm just trying to think what icons you will have. It looks like a little speech box with writing in it. And up there, if you click on that box, you can submit a question. So if you have a question for Penelope, just go up to the little speech bubble with text in it and write your question there, and we'll be able to view those questions at the end. If that box, or you can't find that box, just type your question in the attendee chat box and we'll see it there as well. But if you can put it up in the question box, that would be really awesome. Awesome. Sounds breaking up for some people. So hopefully things will go smoothly. If Penelope does drop out today, hopefully everything will be okay, but we're noticing that we're getting a little bit of a drop back in. So if she does disappear, just be patient and hopefully she'll be back on in a few seconds. If she doesn't, I'll come back on and entertain you until she does. So I think that is all the logistics. And so I'm going to hand over to Penelope to do today's webinar. So thank you very much.
Thanks so much, Sally. Okay, hi everyone. Thanks so much for listening in. So as Sally said, I'm going to be talking to you today about the Trans Pathway study. And specifically, I'm going to really be focusing on the experiences with medical and mental health care services. So Trans Pathways was a study that was a collaboration between the Telethon Kids Institute, University of Western Australia, Curtin University, YouthLink, which is a North Metro mental health service here in WA, and the Freedom Centre. Next slide. So what I'm going to be doing today in the webinar is first I'm going to give you an introduction into what Trans Pathways was, just in case you're unaware of the study. Here's our beautiful report cover that was designed by a trans young person here in Perth. And then I'm going to be talking about the mental health results of our study. So these are mental health that's experienced by trans young people in Australia, and this will really solidify why we need to improve the services that are currently available in Australia. After that, I'm going to move on to talking about experiences with accessing medical and mental health services to really cover what is wrong with the current services that are provided, and then we can sort of infer from that what needs to really be improved. From that, I'm going to discuss the recommendations that we've put together in the report and the next steps that we suggest going forward. So first off, as I briefly mentioned, I'd like to mention that all of the artwork that is in our report was designed by a local trans young person in Perth who is currently studying graphic design and did a wonderful job. And you'll see a lot of these images throughout my slides here today, but also in the full report, which is available free to download online, you'll be able to look at those images. And we do have some lovely hard copies. So we've distributed some of these to health services and other things. So if you think there's somebody who really needs a hard copy of the report, feel free to reach out. And also Jason Mitchell is he's available for commissioned work. So feel free to contact us if you'd like to get in contact with the artist. So starting off, what does it mean to be trans? Here I go. Am I back?
Yes, you're back.
Here I go. Okay. Sorry, I got disconnected briefly. So what does it mean to be trans? So Jason did this beautiful image talking about how there is no one way to be transgender. We use the word trans within this report to be inclusive of people who identify as non-binary, genderqueer, trans women, trans men, gender diverse, basically anything within the gender diverse umbrella is what we're talking about in this report when we use the word trans. And that's how it was described when we were promoting the study to trans young people. So why we did trans pathways. So we know, I'm not going to go really into depth in the background of the research. There's a lot of literature out there, especially around LGBTIQ young people. And so there's a lot out there. Feel free to get in touch with me if you want any literature. Just broadly, what we know from previous research is that LGBTIQ young people experience higher levels of mental health difficulties than their cisgender heterosexual peers. And there's a huge need for trans-specific research. We also know that there are more gender diverse young people in Australia and worldwide than ever before, and we see these young people approaching medical mental health services for support and for gender-affirming medical care. We do know that there is not enough known about trans and gender diverse young people in Australia, and this is really basically the second national study that has happened as an online survey with trans young people, the first of which was from Blues to Rainbows, which is also another report that's available freely online if you want to search that, which provides a great understanding into the role that activism and positive experiences play for trans young people. What we wanted to do with Trans Pathways was really look into the mental health and sort of the more issues that young people are facing and experiences that are negative for young people that may have an effect on their mental health. Also, there weren't really any other national studies that examined the barriers to services that these trans young people are facing in Australia. So Trans Pathways is the largest study that's ever been conducted in Australia with trans young people on their mental health. So what we did a mixed methods questionnaire that was online for trans and gender diverse young people aged 14 to 25, as well as parents and guardians of trans young people who have a child that's 25 or younger. So the survey was online and national, and it was an unfunded study that we promoted through social media, health services, LGBTIQ support groups, community spaces, and word of mouth. So the topics that we covered in the surveys for both trans and gender diverse young people, as well as parents, were really around mental health, so self-reported psychiatric diagnoses, as well as some psychological scales to measure current symptoms of distress. We also looked at drivers and protective factors of mental health, so things that might make people feel down about themselves, as well as things that have a positive effect on mental health. And then, of course, experiences with accessing medical and mental health services. So while this survey was for young people and parents, these were parallel surveys. So these are not the parents of the young people who filled in the survey, but rather completely anonymous, unrelated parents and young people. I mean, there might be some overlap, but as far as we know, they're completely separate. And basically, we included the parent perspective because it hasn't really been done in Australia either. And while we Okay, I'm going to do this without the video to see if that works better with the connection. Can everybody hear me? Yes, okay, awesome. Yes, lots of yeses. Okay, so Yes, back to the topic. So why we included the parent perspective was we largely don't know what the parent perspective of raising a trans kid in Australia is like on a national basis. And we recognise that the parents who are filling in our survey, taking the time, are much more likely to be supportive of their trans kids. So these results probably are quite skewed towards the supportive parent. So just bear that in mind as we go through these results. So our young person participants, we had 859 trans and gender diverse young people complete the survey. Gender identity, we allowed young people to describe their gender identity and their sexual orientation in their own words. So what you see here are two word clouds, one for gender and one for sexuality. And this just shows you the diversity of terms that young people are using to describe their gender and their sexuality. So we grouped the gender identities together into sort of their main umbrella terms, and what we found was we had about 30% male participants, 15% female, and 48.6% identified with non-binary identities. So that's really showing just how important it is to recognise non-binary identities, and which largely is left out of a lot of conversations around what it means to be trans. So we also asked about sex assigned at birth. So we had 639 people assigned female at birth and 220 assigned male at birth. The mean age of participants was about 19 years old. So we had 194 parents and guardians participate in the survey as well, and this was almost 90% mothers. The child sex assigned at birth was a bit more split 50-50, with 42% assigned male at birth and 57% assigned female at birth. We also asked the parents to describe their child's gender in the words that the child uses, and what we found was this is a much more binary notion of gender. So whether that reflects the parents' understanding of gender as a more binary notion, or whether those kids just happen to identify in a more binary way, we're not really sure. But what we're seeing is 44% identifying as male, 34% identifying as female, and just about 10% identifying as non-binary. Okay, so just reading the comments it's going through. So when we are talking about services in this presentation, I just wanted to highlight the services that we asked about in relation to mental health and on medical reasons related to gender identity. So we're not talking about a trans young person seeing a GP for a cold or something like that. We're talking about specifically for something to do with their gender. So we covered GPs, psychiatry services, therapy and counselling services, mental health inpatient services, as well as medical transitioning services. I've got crisis accommodation services here as a separate point, because for crisis accommodation, we didn't ask about that in relation to gender, but we asked about that in regards to just general homeless. Okay, I'm back again. So as I was saying, the crisis accommodation services were not necessarily in relation to gender. So moving on, so talking directly about mental health, these are the psychiatric diagnoses that we asked about. So what you see is about 3 in 4 young people have ever been diagnosed with depression. We've got 72% ever diagnosed with anxiety. About a quarter of trans young people have been diagnosed with PTSD, and you see similar high rates for eating disorders, autism spectrum disorders, personality disorders, psychosis, and substance use disorders. And what we see with these rates of depression and anxiety is that these rates are about 10 times higher than what is seen in adolescents in the general Australian population. Going a bit further into anxiety, we also included the GAD-7 in the survey to measure current symptoms of anxiety during the past 2 weeks. And what we see here is about 62% of young people have levels of moderate or severe anxiety. And this graph I've got here is actually opposite. It's reverse to what you would see in the general non-clinical population, where in the general population you would see the smallest number of people in the severe category, but we're seeing the opposite, where the graph climbs from minimal to mild to moderate to severe, with the most amount of people in the severe category of anxiety symptoms. So that's really quite distressing. So we also included the PHQ to measure current symptoms of depression. So we see very similar rates to the diagnosis rates, where we've got 76% displaying moderate to severe depressive symptoms. And again, with this graph, it is opposite to what we see in the general non-clinical population. So we also asked about social anxiety using the SPS and the social interaction anxiety scale, as well as the brief fear of negative evaluation. And what all of these scales tell us is that trans young people, as some may expect, being in a social environment can be very distressing. And so we've got 92% scoring in the clinical range for social phobia. Now, these are very short scales and not diagnoses or anything like that, but they just give us a little insight into current symptoms of anxiety. So we also asked about autism through including the autism quotient, which is, again, a very short scale that just gives a little idea if a young person is displaying possible traits of autism and whether they would warrant further diagnostic tests. So what we see with our results is about 35% of young people scored in the range that would warrant further diagnostic tests. Just going back to the diagnoses that people reported, so we had 22% of participants reporting that they'd ever received a diagnosis of ASD. I've just included the parent report rate here too, just to give a little insight. So the parents reported that 18% of their kids had ever been diagnosed with an autism spectrum disorder. So these are very interesting results, and what we're seeing clinically is co-occurring autism and gender dysphoria. Okay, I'm back again. So what we're seeing is a clinical co-occurrence, and these results are interesting, however, very controversial, because some people internationally we see are using this to justify not providing hormone therapies. So there is much further investigation needed in this area. So we also asked if participants had ever been diagnosed with gender dysphoria, gender identity disorder, or transsexualism. And we gave a huge disclaimer that we know these terms can be very offensive and distressing. However, within Australia, these are the diagnoses that a young person may receive in order to receive gender-affirming hormones. So while these terms are not accurate or not necessarily representative of what the young person feels about their gender, these are diagnoses that are often recorded for that young person. So what we see is almost 50% have been diagnosed by a health professional with gender dysphoria, 38% have not received a diagnosis, and 13% were not sure. So again, they may not necessarily know that their clinician has recorded this diagnosis. So we also asked about eating disorders. So on the next slide, I'll go into the actual diagnoses of eating disorders. However, we also asked if young people had ever limited or increased both their eating and exercise behaviours. So what we see here, we've got 1 in 4 have ever limited their exercise because of their gender, 2 out of 3 have ever limited their eating because of their gender, 2 out of 3 have ever increased their exercise because of gender, and 1 out of 3 have ever increased their eating because of their gender. So these behaviours have been recorded in other research to do with a young person, or adult for that matter, anybody wanting to shape their body into the body that they want to be expressing. So that may be increasing your eating to hide hips or other sort of very feminine, very masculine body parts, or again, limiting your eating to do the sort of opposite again, to sort of hide feminine and masculine aspects of bodies. So throughout these slides, since this is the first quote you can see here, because this was a mixed method study, we do have a lot of qualitative data from participants. And so I've included some quotes in these slides. There are many, many more in the report, and I do encourage you to read through them because they are very insightful. So I won't read out all the quotes, so feel free to read them in your own time. So in terms of diagnoses of eating disorders, we've got 22% have ever been diagnosed with an eating disorder. Only about 6% are currently diagnosed, and of those 6%, about half are receiving treatment. So it's another area that requires more attention. So moving on to self-harm and suicide. So we asked about self-harm and suicide behaviours through people wanting to self-harm, engaging in self-harm, engaging in reckless behaviour, specifically to put their life at risk, suicidal thoughts, and suicide attempts. So in this graph here, you can see the blue is sort of the lifetime behaviours, and the purple is behaviours within the last 12 months. So we've got almost 80% of young people have ever self-harmed, and that's about 7 times higher than the Young Minds Matter study, which was on the general adolescent population in Australia. The suicide attempt rate's 48%, incredibly high, and this is about 20 times higher than Young Minds Matter and about 15 times higher than the general Australian population. Okay, I'm back again. So again, the suicide attempt rate is about 15 times higher than the general Australian population aged 16 to 85. Now, what's interesting about this data is statistically we looked at whether there was a difference between participants who are under 18 or over 18, and what we see is there's no statistically significant difference between those age groups. And so what we infer that means is that these behaviours are starting from an incredibly young age, and it really is quite distressing to see. So just to wrap up the mental health, so what this tells us is that mental health issues are common for trans young people in Australia, and what we saw was about 3 in 4 have been diagnosed with depression, almost 3 in 4 have been diagnosed with anxiety, 3 in 4 are displaying current symptoms of depression, and almost 1 in 2 have attempted suicide. So what we can take from this is that it is incredibly important that these young people are able to obtain the support they need from a trans-friendly and knowledgeable practitioner. So bearing that in mind, we also asked, just quickly, why these trans young people might be experiencing these high rates of mental health issues, because we know that mental health issues are not because of someone's gender, but they're rather to how gender diversity is treated in our society. So I really like this quote here, which says, "To me, it's not the fact that I'm trans that cause problems. It's that general society doesn't accept trans people. I'm not anxious in public because I'm trans. I'm anxious in public because people tend to be threatened by people like me. I'm not depressed because I'm trans. I'm depressed because general society excludes people like me from support." So we also asked about potential drivers of poor mental health. And what we've done in the report is linked these to mental health diagnoses statistically. So you can have further reading of that in the report to see what things might have an effect on a young person's mental health. But you can see incredibly high rates of peer rejection. So 89% have ever been rejected by peers. We've got almost 80% have ever experienced issues with school, university, or TAFE. 74% have been bullied. 66% have felt isolated from not knowing other trans people. And incredible 65% have ever experienced a lack of family support. So we also asked about abuse. So again, these results are quite distressing. So we've got about a quarter of young people have ever experienced physical abuse within their family, and about a quarter of young people have ever experienced sexual abuse outside of the family. So I'll let you have a read of these. But basically, these rates of abuse are incredibly high. And again, that comes back to the lack of family support and lack of support from general society. So these are all things to really keep in mind when we're talking about these high mental health rates of why these young people might be distressed. It's not because they're trans, but it's because of these very negative experiences. So we also asked about what people do to feel better about themselves and their lives. So we had almost 84% turn to music and art. We've got 83% turning to peers and friends to feel better. We've got 65% loving pets, high rates of books and movies, so these things to escape the world. So other things were video games, computer games, so these online worlds, online platforms where people can sort of shape their identity as they want to be seen by others and have the freedom to do so. I've highlighted here mental health support and or counselling because only about half of these young Okay, I'm back. So only about half of these young people turn to mental health support and or counselling to feel better about themselves, which, considering the high rates of depression, anxiety, self-harming and suicide, we'd really want to see more young people reaching out for support. So a couple coping behaviours that people do. So we've got about a third of young people using alcohol or other drugs to feel better, 31% harming or punishing themselves, and 27% engaging in reckless behaviour where they don't care what happens to them. So this quote here describes how a young person is doing drugs to forget that they were born female, think I'm male. It's really nice to have that feeling. I also forget how the world feels about queer people and I can just be carefree and happy with my girlfriend. So again, these coping behaviours are not ideal for young people. We would prefer to see young people turning to support, especially with quite distressing behaviours that they've been exposed to, experiences that they've been exposed to. So just briefly, I just wanted to touch on why do trans young people want to access services? So there's multiple reasons to do with gender. So the first off is information. So what we hear is that parents often or a young person will go to their GP to get some general information on what they're going through. And this, might be at the very early stages when the young person is still realising that they're trans and shaping their gender identity. So on that as well, it's often led by parents, and also health services can provide information for parents who have a kid who's identifying as transgender diverse. Young people will also access health services for mental health support and also for gender-affirming services such as hormones, which I'll talk about more in a little bit. So obviously also trans young people access services for general health needs, which I'm not touching on here, again, because we asked about services in relation to gender. So those experiences we don't have, but I wanted to really point out that accessing services for general health can also be a very transphobic experience where what we know from other research is that the health practitioner will focus on the young person's gender identity rather than whatever health need they're accessing the service for. So that's just something to really keep in mind as well. So talking about social transition before we get into gender affirming sort of medical transition. So social transition means to change your name, your pronouns, maybe hair, maybe clothing, maybe makeup, things that you can do without medical interventions. So we've got 58% of our participants had socially transitioned and about a quarter had partially socially transitioned or were in the progress of doing so. So many of these young people told us that they are out in select circles, such as to close friends, but maybe not to their school or maybe not to their family at home. So that can be quite hard for a young person as well to be sort of switching between these expressions of their self rather than being their true self. And often social transition is really important to think about because being able to change your name and pronouns and how you're referred to by other people can actually be very validating and very self-affirming, especially for young people. And it really is something that is often the first step for gender diverse people to do. So talking about hormones, in Australia, these are referred to as stage 1, stage 2 hormones. So stage 1 hormones are puberty. Okay, I'm back. Stage 1 are puberty blocking hormones. So puberty blocking hormones essentially just put a pause on puberty, and if the young person decides, hey, maybe I don't want to be on hormones anymore, or I don't actually identify as trans, they can go off these puberty blocking hormones and they will go through puberty as they would have done previously. So they really just allow for more time to for a young person to decide what they want to do. Again, you would go on puberty blockers around Tanner stage 2 or 3, so when you're early stages of puberty. And so the advantage of going on puberty blockers is that they prevent secondary sex characteristics from settling in. So things like an Adam's apple growing, or hips widening, breast growth, beard growth, facial hair or other bodily hair. Basically, it just puts a pause on all of that. And those changes that do happen, such as a male assigned at birth having the Adam's apple and a beard and getting very tall and having broad shoulders, those are changes that are very hard to alter in someone's body later on in life. So it's important to allow young people to access puberty blockers if they want to. So what we found is about 5% of our participants are currently on or have previously used puberty blockers as a child or adolescent. An additional 30% wanted to, but they were unable to access what they want. So that's really important, that there's a third of our participants wanted puberty blockers but couldn't access that. So that could be for various reasons. Maybe there's no service providers in their area that know about puberty blockers, or perhaps these are young people who don't have the support of their parents, so that creates additional barrier. There are many reasons there. So going on to stage 2 hormones, which are also known as cross-sex hormones. So these are hormones that have the effect of masculinizing or feminizing, so generally estrogen or testosterone, and other variations like that. So we have 28% of our participants had currently used or previously used stage 2 hormones. Additional 10% wanted to but were unable to access what they want, and almost 35% wanted to use these hormones in the future. So again, the age at which you would start cross-sex hormones varies. Currently in Australia, if you want to access stage 2 hormones, you still have to go through the family court if you're under 18. So a lot of young people don't start these hormones until they're over the age of 18, whereas we see internationally in the US and Amsterdam, some clinics are starting trans kids on hormones a bit earlier than that, around 14 or 16, and really depends on the young person's growth and pubertal development. So talking about surgeries as well, keeping in mind the age of our participants, 14 to 25, so some are quite young. So we only had about 6% of young people that had gender-affirming surgery or surgeries. Additional 15% wanted to but couldn't access that because of the cost. About 20% want surgery in the future. So this could be just top surgery or bottom surgery. There are many different surgeries that trans people may want to access at some point, and in Australia there really are very few surgeons who provide these surgeries, unfortunately. So you see a lot of young people travelling, or adults travelling internationally for the surgeries that they want to have. So I'll start talking about our results in relation to specific service providers now. So we asked about these different service providers, if young people had ever accessed these in regards to their gender identity. So we had I'm back now. We had 65% of young people had access to GP in regards to their gender identity. We also asked about if people were satisfied with the service that they received once accessed. So we had 57% satisfied with the service from GPs and 19% dissatisfied. That remaining percentage is neutral, so I haven't included that here. But so see, over half are satisfied with the service they received from GPs. And so we have very mixed reports of whether the GP was understanding, knowledgeable, or just open-minded. So whether the GP actually was aware of gender diversity and could help the young person efficiently and gave the appropriate referrals, or some other people said, oh, my GP had no idea about gender diversity, but they were very friendly, they were very open-minded, they were willing to do the work to figure out where I needed to get to. So mixed reports there. Participants often felt they needed to educate their GP on trans issues, which is a real worry, especially for young people who, are looking for validation of their identity, especially if they're not feeling supported at home. So it really is important that health services help to validate these young people and what they're feeling. So what we had that's quite distressing is some young people were told they were just going through a phase, and that's really a very negative experience for anybody, and especially a young person developing their identity. What we also found is trans-friendly GPs have very long waiting lists. So someone might find out online or through other means about a GP who knows what they're doing in this area, is capable of making the correct referrals. However, the young person has to wait a very long time to see them. So that's also a negative experience. So we asked about gender-affirming services separately. So it's important to recognise that not all people who are trans wish to pursue medical transition at all, and also what that medical transition means for the young person can differ greatly. So for some people, it may just mean hormones, may just mean puberty blockers. For some, they may be seeking puberty blockers, hormones, and then surgeries later on. So it really depends on the person and what they want to get out of the service. So about a third of participants had access to medical transitioning services, and 66% were satisfied with the service received, and 16% were dissatisfied with the service they received. So with our data on this, we are aware that some young people may not have ticked gender-affirming services. They may have just said, oh, well, I access the GP for my gender. So we may not be including everyone in this, just to keep that in mind. So of the young people who access medical services for transition purposes, we had 57% seeing a private endocrinologist, 35% saw a private surgeon, 21% went to an adult hospital, and 18% went to a children's hospital. And participants may have accessed multiple services, so these are not mutually exclusive. So experiences at these services were tended to be very long waiting lists. So what we know and what's reported from the gender clinics across Australia is there are long waiting lists. There's not nearly enough funding to have the staff at these clinics to see all of the clients that are requesting appointments. We also know that gender-affirming services can be very expensive, especially surgeries and especially hormones for some people. So a lot of these things are not covered by Medicare or private health insurance, and so that's really something we're pushing for as well. There were many positive experiences. Okay, I'm back again. There were very many positive experiences. However, keep in mind, this was once the service was accessed. So here you've got a male who's 21. He was a lovely endo, understanding, listened and talked and assured me of things I doubted and feared. He was great and bulk billed and respectful of my identity. So that's sort of your ideal situation, what you want to find. However, many young people reported very different experiences with experiencing long waiting lists and costs and substandard care. So for psychiatry services, we had 43% of our participants had access to psychiatrists in relation to their gender identity. These were mixed, whether it was public or private psychiatrist, and 42% were satisfied with the service received, and about 31% were dissatisfied. So psychiatrists didn't do so well on our survey with how they were helping young people. So negative experience of psychiatrists were more common than positive ones, and what we saw commonly was misgendering, gatekeeping, so young people would have to see a psychiatrist in order to get a letter approving them for hormones. They felt the experience was very pathologizing, often non-binary identities were not acknowledged, and generally there was a lack of trans knowledge and trans-friendly services among the psychiatrist experiences. Overall, again, this was an expensive expensive service for many young people, and a lot of young people felt they had to prove they were trans enough, again, in order to get that letter for hormone approval. So we also asked about therapy and counselling services. So 64% of young people had accessed therapy and counselling in relation to their gender identity. And these did much better than psychiatrists. So we had 60% were satisfied with the service and 16% were dissatisfied with the service received from therapy and counselling. So the positive experiences were largely around a welcoming environment. So where this young person here, female who's 20, says, I went in, was asked what pronouns I wanted and what name I wanted used, and was just generally treated so well. It was amazing. For once, I actually enjoyed being there. We also asked about Headspace separately. So, and a lot of young people, Headspace mostly received a very positive experience for young people. So that's really good to hear, especially with Headspace having many locations across Australia. However, it was still important to acknowledge that the psychologist needed to be knowledgeable on gender diversity. So that was a common theme as well, where some young people said, oh, my psychologist is really helping me with my depression, anxiety, but they don't know anything about gender. So again, it's important that while these therapists and counsellors may be efficient at what they do, it is important that when we're talking about upskilling service providers, we talk about all service providers, including psychologists. So the last one I'm going to talk about is mental health inpatient services. So only about 12% of young people had access to mental health inpatient service, and that's not surprising because usually what young people said they were accessing mental health inpatient services for were related to suicide attempts, some self-harm and some eating disorders, but mostly suicide attempts. So we expect a high dissatisfaction rate with that, but still we'd want it to be a welcoming environment. So what we saw was about 20% young people were satisfied with the service received, 43% were dissatisfied. So we also asked, were staff respectful of your gender identity? And so we've got 34% of young people who'd accessed mental health inpatient service said staff was not respectful of their gender identity. So that's, again, a really important finding to bear in mind. The experiences were overwhelmingly negative. So with young people feeling othered and the staff were using the wrong names or the wrong pronouns, that was a consistent thing, and young people recognised that it was useful keeping them safe in the short term, but there was no specific help or information that would be ongoing. And again, often that was related with gender. So I'm going to move on to accommodation issues now. I'm just speeding up a little bit because I'm wary of the time. I want to have time for questions. So we asked young people about accommodation issues, and 22% of young people had experienced accommodation issues, including unstable accommodation, homelessness or couch surfing. So not specifically just living on the street, but including feeling like their accommodation was unstable. And so of those, looking at this statistically, of those who had attempted suicide, they were more likely to report having experienced these issues. So there's the odds ratios there. So people who had attempted suicide were 5.3 times more likely to have experienced accommodation issues than those who had not attempted suicide. So the quote here from a female who's 25 says, well, it's hard to get housing in Australia unless you have a job. And getting a job while transitioning Australia is hardly possible. So then a lot of trans people who don't have the support of their family and friends or don't live with family end up in crisis accommodation. That's a big issue. So we also asked in a separate part of the survey, have you ever been homeless? So 17% of our participants had ever been homeless, and of those, 38% had accessed crisis accommodation service, and of those who'd accessed a service, 43% felt their gender identity was not respected by the crisis accommodation service that they sought. So again, that's a really important finding that needs to have action come out of. So other research has told us that trans youth have experienced unstable accommodation find it more difficult to access medical and mental health care in the long run. So again, these are issues that really need to be addressed in Australia. So overall, 60% of participants said they felt isolated from medical and mental health services. And those young people who reported that, they had higher rates of self-harming, suicidal thoughts, suicide attempts, and diagnoses of PTSD and anxiety than those who did not experience feeling isolated. Just to highlight, there's a real need for education. Sorry, one of the phones is ringing in here. I'll just mute myself. I'm very sorry, one of the office phones was ringing. I didn't want to have you all listen to that. So, the need for education. So what we found was 42% of trans young people had reached out to a service provider who did not understand, respect, or have previous experience with gender diverse people. So I've included this image here of community means everything because a common theme through all of the services, all of the experiences that people talked about in relation to services were around often word of mouth. So whether that was through a community service such as Freedom Centre or 2010 or someone like that recommending a service provider, a lot. So yeah, a lot of these links are done through word of mouth and through community. And so it's really important that we are able to expand these services that do a good job of assisting gender diverse people because, again, the long waiting list, the cost, it's really important that we have efficient and very good services out there for support. So I just wanted to briefly touch on as well unsupportive families. So going back, 65% of our participants said they'd ever experienced a lack of family support. And of the parents, we had parents saying that 20%, so of the parents, they're young people, 20% had ever been unsupported by family. So whether that was the parent themselves or somebody else in their family. So again, that's quite high. And in looking at this statistically again, so of the people who had attempted suicide, they were 1.9 times more likely to have experienced a lack of family support. So we also asked parents about family acceptance. And this quote, I think, is one of the most powerful to come out of the report. So this mother of 15-year-old male says, "The thing that stopped me in my tracks or really hit me between the eyes were when a counsellor basically said to me, keeping in mind the rate of suicide with these kids, you can have a happy little boy or you could end up with a dead little girl. I would never forgive myself if my child's unhappiness was due to my not listening to him or because he had to suppress what he felt because I was denying him being who he truly was." So we asked parents about acceptance and sort of what helped them accept their child and nurture their child. And so it's a really wonderful quotes, many more in the report, but largely parents were talking about education and knowledge. So being, before they had their child come to them and say they were trans or before they realized that their child was trans, a lot of these parents said that they'd never known a trans person before in their life and they just had no idea what it even meant to be gender diverse. And so there really is a huge need for education, not only for service providers, but for parents. And for a young person, you're really talking about all of these links. So you're talking about the school environment, the home environment, as well as the medical mental health service environment. All of these things need to be supportive places for young gender diverse people. So to say a couple positive things, because there's been a lot of negative discussion here on mental health. So we also asked parents what's positive about having a trans child, because we recognise that parents spent over an hour on this survey filling in all our questions, and a lot of it was talking about the history of suicide and, very distressing experiences. So we wanted to end on a very positive note and really value the celebration that can come with having a trans child. So parents told us about how having a trans child has made them more open-minded, has made them focus on the mental health and well-being of their entire family. They've talked about how much pride they have in their child's strength. And again, there's many more quotes to read through. So the really wonderful parents who've spent the time filling in our survey. We also asked young people what's great about being trans. So young people said things that were very similar to the parents about how it made them accept and be more aware of diversity in general, and how it made them more open-minded and caring. There's a great quote here from a non-binary 18-year-old. "No need to adhere to gendered beauty standards. I can just be ambiguously cute." And there's another one here from an agender 22-year-old. Yes, so who talks about gender euphoria, so a play on the word gender dysphoria, which is pretty good. So to conclude, what we see is that trans young people are experiencing mental health issues at much higher rate than their cisgender peers in Australia. The frequency of these mental health issues really demonstrate the need for interventions to improve mental health, so including service expansions and other needs like that. Awareness of gender diversity must be readily available for trans young people and their parents. So we really need these home environments that trans kids are growing up in to be supportive. So going forward, our team is looking at how service providers can improve their care of gender diverse young people. And other research areas really needing focus are on Aboriginal and Torres Strait Islander gender diverse young people, the potential relationship between ASD and gender diversity, how parents can better support their trans kids, as well as upskilling service providers. So our report ended with some recommendations for services and for government. So for services, we recommend that there is an increase of funding for services for trans people, both adults and under 18s. Services need to be improved where they are perceived to be substandard, and we need enhanced accessibility of services. For government, we really need public policies to be trans inclusive, as well as data collection methods. So things like the census really need to be be inclusive of trans people on there, so we can really show just how many trans people there are in Australia. There needs to be better education on gender diversity and practical information on how to uphold the rights of trans people, and there needs to be an increase of funding for provision and enhancement of gender services, as well as research. So what we're doing next, we are holding roundtables and community forums with the results of our study to see how these can be put into action. So the link is there for the full report. Again, it's free to download, so just go to telethonkids.org.au/transpathways, and there's my email address if you'd like to email me any questions. So thanks so much for listening today, and I think we'll move on to questions now.
Awesome. Thank you so much, Penelope. I'm just going to turn on my webcam to see whether if it has too many interruptions, I will turn that off. So we did have some questions added throughout, so I'm going to just show them now. So Penelope, the first question here, and everyone should be able to see that on the screen, about what are the most effective ways to engage. So do you want to reflect upon that question and what are your thoughts on that?
So it's a very interesting question, and I think the problem that we see is there are experts in gender and there are experts in autism, and we don't really have anyone that I'm really aware of who is an expert in both areas, so who can really play a part, tease apart the autism and the gender dysphoria or gender diversity. And so it really comes down to the clinicians being very careful, but also very aware that the gender that the young person identifies as could, most times is very, very real and a part of that person's identity, and to not ignore that based on the fact that they have autism.
Awesome. Thank you. Okay, the next question. I'm actually just hoping that people can see that question up on the screen. But here's another question around the risks around hormone blockers. If you're able, I'm not sure whether your knowledge extends to be able to reflect upon this.
Yeah. Connected? Reconnected. Here we go. So look, there aren't a huge number of long-term studies that have been done with hormone blockers, but I'm not sure on that exact question, whether the growth is stunted. That's something that is a bit out of my area. However, I do suggest you do some research into the literature on that. And we're actually, another project that I'm involved in is setting up a longitudinal study out of the Gender Clinic here in Perth to be measuring these sorts of things on hormone blockers and the effect they have on person's health and mental health.
Awesome. The next one was someone reflecting upon about education and training, and I guess this is a hard one to answer. And I guess my reflection often is that there is never enough training or education available, which is one of the reasons actually we do these webinars, is to make professional development available. Did you have any reflections, Penelope, on what you know is out there?
Yeah, I think that I agree with you that there does need to be a lot more, because what we're seeing is often students and medical students as well as counselling students, will get maybe one lecture in their whole education that covers sort of the whole LGBTI health spectrum in one lecture, which is really insufficient. So we are actually looking over the next couple of years of developing some education and training programs. There are some online that are free about trans health. So there are a couple online, and I can email. They may actually be on the LGBT Alliance website.
Yeah, potentially. We do like to share access to training development where possible. So we'll keep an eye out for that, and we can share that through our newsletters.
Yeah.
Cool. There's actually a bunch of questions coming through. So here's one about, do you have the breakdown of what type of counselling people accessed?
We don't, unfortunately. We don't have phone versus face-to-face. Unfortunately, that's not something we asked. The survey was incredibly long, and I should have actually mentioned we held focus groups in the beginning, both with young people and with parents of trans kids, to discuss what questions should be included in the survey. And they suggested we added a lot more questions. So the survey really was, some people spent an hour and a half on it. So we did have to limit our questions, unfortunately.
No worries. So question here, what's the best way for health service providers to advertise or to alert the community they're trans friendly?
I think there are some very simple things that people can do. So that's a matter of having, the LGBT rainbow flag, also the trans flag up. Little things like that at reception can help it feel like a welcoming place, but also on intake forms. So on any forms that the client's going to have to fill out, allowing that person to have their name that they use that perhaps is not their legal name, as well as specifying their gender and their pronouns. Like those very simple things of using a person's name that they want to be called and using the pronouns that they use. Those are two very easy things that anyone can do to make a young person feel welcome.
Awesome. Were there any questions asked around sexual health?
No, we didn't ask about sexual health, unfortunately.
Okay, that's cool. So a counsellor would like to sorry, I'm just looking. Oh, so a question about training again. I think for training, for the time being, if you want to head to the Alliance's website, which is lgbtihealth.org.au, we do have some links to training that's provided by state-based providers or local providers. So check that out for the time being. And if there's anything else that we come across, we can share that with participants as well.
Mm-hmm.
Okay.
Yeah, I think so. This question is very complex around centralised models of care versus upskilling GPs more broadly. And I think both are ideal, right? Because I think having these gender clinics that are multidisciplinary teams are great. It's great to have a psychologist, psychiatrist, endocrinologist all in the same place. But on the other hand, I do think all GPs and all psychologists really should be aware of trans-inclusive language and trans healthcare. So I think ideally both, and I don't know if there's one that's better than the other.
Awesome. So how do you get to know when the forums are on that you spoke about at the end?
Yes. So they're still being planned. So the best thing is to email me, and we have a running sort of contact list to email once we have a plan more in place.
Excellent. And I'll put your contact details back up on the screen when we finish the questions.
Great.
Okay, all these other questions, how many we've got left? So trans young people with trauma around, that's a really interesting questions.
Around the diagnosis of gender dysphoria, or?
Yeah, so I guess about like the trauma that has arisen from around being diagnosed.
Yes, so we that is another question that we have asked, but we haven't actually put in the report yet. So we asked both parents and young people whether they think there should be a diagnosis, and so that is something that we will be releasing and reporting on soon, but it was outside of the scope of this report, so we'll have more on that soon, so stay tuned.
Cool, thank you. A couple more left. About NDIS. I guess this is a big complex question as well, and I know that certainly the Alliance, we've been doing some work with NDIA around the inclusion of LGBTI people within the NDIS. And I think from what we know at the moment, this is still really up in the air about how this will work and how inclusive the NDIS will be to LGBTI people more broadly, but specifically for trans or gender diverse young people. Have you come across any feedback or anything yet, Penelope, about?
I don't have any feedback on that from this survey. I was just in the US and I had a meeting at the Williams Institute in UCLA, and so they were talking about a similar thing of whether to sort of be, it's both positive and negative to include, gender identity, healthcare within the disability framework. So it's a very complex area.
Yeah, I think it is quite complex, and so this is a much larger, huger conversation. And I think generally people's perceptions might be that because it is in the DSM, therefore there will be access to treatment and services, but that actually isn't the case. So by gender dysphoria being in the DSM, it actually doesn't mean that there's more access to care. And certainly, I know NDIS, there's been a large number of people who've been left out of the NDIS who initially thought they would be included. And so certainly there's been nothing specifically around LGBTI, but the Alliance is doing some work with the NDIA around LGBTI inclusion. But I still think a large number of people will be left out of that space. So a really interesting question. That's a whole nother conversation, but fascinating. Okay, Penelope's just dropped out. Hopefully she'll come back on. So what advice do you have for hospitals? And I think there's just one more question after this.
I think it's really important that hospitals, so I'm not sure if you mean specifically gender clinics within hospitals, but I think both. It's so important that hospitals connect back to GPs as well as local psychologists and other services, because obviously having trans people come to the hospital to receive their hormone injections and things like that is very pathologizing, and it's it's much easier just to go down to your GP or to your local psychologist to see, but of course then the cost comes up with that as well. But I do think it's so important that hospitals remain connected with GPs in the area so they can refer people appropriately and back and forth. And
many local areas actually have informal lists of trans-friendly GPs around the places. So usually if you contact your local trans group or your local LGBTI organisation, they generally would have a sort of an in-house list of these are the friendly GPs that they've usually connected through word of mouth and through personal experiences over the years. So certainly trying to locate who the community considers to be your trans-friendly GPs could be a great start for connecting with them.
Definitely.
Someone just put a comment up here about the Gender Centre has some useful information for service providers for trans people accessing. So head over to the Gender Centre website to check out their resources, and I agree they have some great resources there. And one last question before we wrap on up. Data around drug and alcohol services.
We don't, actually. We didn't ask about that, unfortunately. I did just want to mention on the previous point as well, the Gender Centre does have a lot of resources, and also parents of gender diverse children, they have a website and they're incredibly useful at networking and linking you up to your local gender diverse community.
Awesome. Thank you so much. I know we probably didn't give those questions justice on the time that they really needed. And I really appreciate everyone submitting some really thoughtful and considered questions. And I really shows to me that people are really craving knowledge and information and resources about how to better work with trans and gender diverse people, and particularly young people. So hopefully today's webinar helped somewhat to give people access to some information. I really encourage people to check out this report. It's really wonderful and really comprehensive. And Penelope's contact details are just up there on screen. So if you have any further questions about the report, please feel free to get in touch. So thank you, everybody. We'll end today's webinar, and please keep connected with Mind Out for future webinars. And thank you so much for joining us.
Thank you, everyone.